This was a study funded by our Sigma Theta Tau chapter, Lambda Gamma, and it was a study that was done with me and members of the Phi Xi chapter of Sigma Theta Tau in Portugal, where I'm also a member. So it's an international study, and this is a study that was an investigation of pediatric nurses who cared for adult patients during COVID. Next slide. So as you all know, the COVID-19 pandemic was very complex, still is very complex. And in many countries of the world, nurses who were certified, who received advanced education, and with many years of experience in their fields, other fields, were asked to or forced to care for adult patients who often had COVID and often were in intensive care units. And this is just a picture of all the different places when COVID was starting. Our study design was in 3 languages. We had 2 surveys that we translated into English, French, and Portuguese. We also translated it into Chinese, but ended up not using it in China. We had the study open for 8 months, and the chapter allowed me to purchase pediatric nursing mailing lists in the United States. And to be in the study, you had to self-identify as a pediatric nurse and had to have volunteered or not volunteered, but cared for adults during COVID. We used 2 surveys. This was a prospective study, so it was done while people were caring for adults during COVID, and it was an exploratory design. It was there were 2 surveys. The first one was a descriptive study using both quantitative and qualitative questions. This was a researcher-created survey with responses and recommendations from pediatric nurses who were caring for adult patients. And some of you on the call participated in the establishment of the content validity to make sure we had a valid tool to use. And then the second survey was from the Canadian Association for Nursing Schools. It was a skills list of 150 med-surg nursing skills that one would have to be a med-surg nurse for adults. And we used this with permission. Next. So in the first survey, we asked people what were the circumstances of their transfer, whether they received any training for the transfer, did they develop comfort levels going from caring for babies or children to caring for adults, what were the ethical challenges that they faced, and what recommendations did they have for administrators or policy for transferring people during future disasters. The second survey had the 150 skills and asked people to identify skills for which they had no experience and no training, but were being asked to do. To analyze the data, we used a qualitative method of naturalistic inquiry and then descriptive statistics on the quantitative questions. You know, I started this study because I'm the journal editor for a pediatric nursing journal, and I started to hear from people around the world that they were being moved into adult care and they were totally not prepared. And so this study was done for pediatric and neonatal well baby nurses who had no experience with sick adults or intensive care, yet they were sent to provide care. And this set of circumstances, although we just studied pediatric nurses, was very similar for other nurses. Rehab nurses went to care for COVID patients, peri-op nurses, nurse anesthetists. Nurses were transferred into the emergency department without emergency department skills. Psychiatric nurses reported that they were asked to care for sick COVID patients. So many nurses around the world reported, great emotional trauma and fear from the rapid change in circumstances. At the time we began the study, there was no nursing literature at all. Found for guidance, I did find 11 articles about physicians, pediatricians having to go work adult care, but there was nothing in the nursing literature. And just as an aside, those of us who work for Kaiser, for Kaiser nurses, those who went to care for adults and intensive care, Kaiser had simulations, we had practice guidelines, we had buddies, and people volunteered. So we did not have these situations that I heard about from others. So the initial results, we have closed the study now. It was open for 8 months. We had 200 nurses sign into our 2 surveys from 12 different countries. The first survey about feelings showed that 67% of the 200 nurses had no choice. They were told they were going to take care of adults in med-surg or the ICU with COVID, and 68% had no preparation whatsoever. They just went to care for adults, being pediatric nurses without any prep. I was somewhat surprised that the comfort level did not improve over time. We asked them at the beginning on a sliding scale of 0 to 100, how comfortable were you? And then at the end, how comfortable were you? And really, they never were very comfortable. It started beforehand on a scale of 1 to 100 at 40, and the highest it ever went was 57. So people did not become comfortable caring for adults. They reported a great deal of stress, a great deal of loneliness, and a lack of support. When we asked who supported you in this change, it really was family. It was not anyone in the administration or peers. And 92% of the 200 people gave recommendations for how they would do this different in a future disaster. In the skills survey, and this to me was somewhat shocking, between 70% to 100% of respondents reported that they had no training and no experience in some of the skills that were probably the most important. 100% said they had no training in assessing for pressure injuries, that they had not cared for a patient on a ventilator. None of them, or very few of them, knew how to provide mental health support or referrals. They had not provided palliative care. They had not comforted families of dying patients, and they had never prepared a body for the morgue. And when you think about what people did during COVID, it was all mental health and palliative care. So this was pretty scary for the respondents. So the preliminary conclusions of this study was that the pandemic came on very suddenly. It affected us all. We hope to write a white paper for the International Council of Nurses to try to help them, see that when nurses are forced to care in areas previously unknown to them, that we can do it in a safer way, a more educated way, and develop a sustainable workforce when nurses have to transfer or float from specialty to specialty during disasters. And we'll be working on the write-up, in the next couple months. So the next slide says, thank you so much to the chapter. Thank you very much to Kaiser Permanente, who gave us institutional review board. And this study also recently won the Commission for Certification at the American Association of Colleges of Nursing Innovative Research Award, which was really lovely to receive. So thank you all very, very much.